Welcome to our presentation on the classification of antitubercular drugs. Tuberculosis, caused by the bacterium Mycobacterium tuberculosis, remains a global health concern. Various drugs have been developed to combat this infectious disease. Today, we'll explore the classification of antitubercular drugs based on their mechanisms of action. First-line antitubercular drugs. First-line antitubercular drugs are the cornerstone of tuberculosis treatment. They are the most effective and commonly used drugs. Let's delve into their classification. Isoniazid, INH. Narrator. Isoniazid is a bactericidal drug that inhibits the synthesis of mycolic acids, essential components of the mycobacterial cell wall. It's a prodrug that requires activation by the bacterial enzyme CATG. Rifampin, RIF. Narrator. Rifampin is a potent bactericidal drug that targets RNA polymerase, a key enzyme for transcription in bacteria. It prevents the synthesis of RNA, thereby halting bacterial growth. Pyrazinamide, PZA. Narrator. Pyrazinamide is a bactericidal drug that targets the mycobacterial cell membrane. It's converted into its active form by the bacterial enzyme PNCA and disrupts the cell membrane's function. Ethambutol, EMB. Ethambutol is a bacteriostatic drug that inhibits arabinosal transferase, an enzyme involved in cell wall synthesis. By disrupting the cell wall, bacterial growth is inhibited. Second-line antitubercular drugs. Second-line antitubercular drugs are used when resistance to first-line drugs occurs or in severe cases. Let's explore this classification. Fluoroquinolones. Fluoroquinolones inhibit DNA gyrase, preventing DNA replication in bacteria. These drugs include levofloxacin, moxifloxacin, and ciprofloxacin. Aminoglycosides. Aminoglycosides, such as streptomycin and amikacin, inhibit protein synthesis by binding to the bacterial ribosome. They disrupt protein production, leading to bacterial death. Macrolides like clarithromycin and azithromycin inhibit protein synthesis by binding to the bacterial ribosome. They are often used in combination therapy. Other antitubercular drugs. In addition to first and second-line drugs, there are other classes of antitubercular drugs with specialized uses. Bedaquiline. Bedaquiline targets the ATP synthase enzyme, disrupting energy production in mycobacteria. It's used for treating multidrug-resistant tuberculosis, MDR-TB. Delamanid. Narrator. Delamanid inhibits mycolic acid synthesis and disrupts the bacterial cell wall. It's also used to treat MDR-TB. Linezolid. Linezolid is an oxazolidinone that inhibits bacterial protein synthesis. It's used for extensively drug-resistant tuberculosis, XDR-TB, treatment. In conclusion, the classification of antitubercular drugs is essential for effective tuberculosis treatment. First-line drugs like isoniazid, rifampin, pyrazinamide, and ethambutol form the foundation of therapy. Second-line drugs, such as fluoroquinolones, aminoglycosides, and macrolides, offer alternatives when resistance occurs. Specialized drugs like bedaquiline, delamanid, and linezolid address drug-resistant cases. Through these classifications, medical professionals can tailor treatment regimens to combat tuberculosis and contribute to a healthier world. Thank you for joining us in this exploration of antitubercular drug classification.